For over 4 decades, one woman has bridged the sacred and the scientific, weaving traditional Indian medicine into the fabric of rural healthcare. Meet Senior Innocent Joseph Ayyankanal, a nun, healer and advocate whose mission reads like a blueprint for holistic care. But here's where it gets controversial. She's challenged the dominance of modern medicine by reviving ancient practices in some of India's most remote regions. Would you support a system where herbal remedies take center stage over costly pharmaceuticals? Let's dive into her story and the questions it raises about healing in the 21st century. Senior Innocent, a member of the Missionary Sisters of Mary Immaculate, has spent 40-plus years championing Ayurveda and other traditional systems in the Nilgiris and Wayanad districts. Born into a family of Vaidyas, traditional healers, she blended her spiritual calling with ancestral knowledge. At 78, she's still active, collaborating with groups like Shalom TV to spread awareness. Her journey began in 1975 at the Maryknoll Convent in Kunnalady, Tamil Nadu, where she noticed a shocking gap in healthcare. Villagers couldn't afford modern medicines, so she transformed an allopathic dispensary into an Ayurvedic clinic, using herbs they already knew. Why give expensive pills when generations have used local remedies? She asked, a question that still sparks debate today. Her approach was radical. Small, community-focused clinics over sprawling hospitals. Inspired by her congregation's founder, Missanger C.J. Varkey, she believed care should be personal, not impersonal. Hospitals shouldn't be cold buildings. They should feel like a warm home, she explained. This philosophy led to mobile clinics near convents, and later, a full Ayurvedic hospital in Kerala, staffed by nuns trained in herbal medicine. Even now, she travels 20 kilometers daily through forests to reach tribal villages, once narrowly escaping wild elephants to treat a patient. The risks are real, she admits, but so is the need. St. Innocent's work isn't just about herbs, it's about empowerment. She taught women to make their own remedies, from anti-diarrhea pills to medicated oils for bruises. For tribal communities, this meant avoiding costly trips to distant hospitals. But she faced pushback. In 1984, a herbal expo she organized drew scorn from modern medical professionals who dismissed Ayurveda as unscientific. Undeterred, she published a book detailing her findings, proving that persistence can turn skepticism into curiosity. One of her most impactful projects, tackling sickle cell disease in Wayanad. After years of research, she developed herbal treatments that transformed lives. A young girl from Pulpali, once near death, now works in her hospital. This is the part her father, a social worker, showed her the power of service, and the nuns who cared for evicted farmers in Karnataka became her role models. I wanted to heal bodies and souls, she says, a goal that feels increasingly urgent in a world torn between tradition and innovation. So here's your challenge. How would you balance ancient wisdom with modern science? Share your thoughts below, because the future of healthcare might depend on it.